are Team 29 presenting on asthma. Our case study depicts a family with a 10-year-old newly diagnosed with asthma following an asthma attack that brought them to the emergency room by ambulance. The child has now been discharged from the emergency room and is back in school. The school nurse and the parents have set up an appointment to discuss the child's asthma and her pump medications. The parents are eager for this encounter, as they feel they have not gotten much information from the ER nurses. The main issue at this point is teaching S and her family how to use the pumps in order to maintain her asthma symptoms under control and prevent another attack. As our main issue revolves around skills pertaining to the use of pumps, this theory is a good fit for our case study, as it focuses on self-efficacy pertaining to skills. With asthma being a chronic condition, it is not only important for the client to master the skills, but also important to sustain the behavior. Studies have shown that a behavioral approach to the management of asthma is best to attain compliance with asthma treatment. Applying the self-efficacy theory in asthma management will help patients in both mastering and sustaining the skills required for effective management of asthma. Moreover, in an article published in a nursing journal on how school nurses can help parents of middle school children cope with newly diagnosed asthma, the self-efficacy theory was cited as playing an important role in promoting parents' self-efficacy to manage their child's disease by offering support and teaching them skills to manage it. The self-efficacy model consists of four main concepts. First is performance accomplishment, which is successfully mastering a behavior. It is most beneficial to master the skills in a series of small steps to build confidence. Second, vicarious experiences exemplifies model behaviors, therefore following role models who have experienced and achieved in self-management of a chronic illness. Third, verbal persuasion involves encouragement from support systems, which includes caretakers, educators, and the client's family. Learned skills can be positively reinforced with encouragement from support systems. Fourth, emotional arousal pertains to self-judgments regarding learned behaviors. Emotional arousal comes about creating a personal feedback system to raise awareness of physiological states and interpreting those feelings to enhance self-efficacy beliefs. The example that will be used to highlight the four concepts is a 10-year-old girl learning how to use an inhaler for her asthma. For performance accomplishment, the child will be learning how to use her pump in a series of steps until she becomes comfortable. Vicarious experiences, the child will turn towards peers who have asthma and communicate with them how they master the skills necessary for the proper use of an asthma pump. Verbal persuasion, using words such as "you can do it," "never give up," from parents, educators, and those involved in the care. Emotional arousal, the child will write in her journal what improvements are required from her to master the use of an inhaler. In a study on 81 African American children, aged 7 to 11, took part in a descriptive correlational study concerning adherence to asthma self-management. The results highlighted that there is a positive correlation between self-efficacy beliefs and self-management behaviors. Therefore, a child with stronger self-efficacy beliefs is more likely to comply and adhere to their treatment plan, which will lead to decreased reoccurrence of asthma symptoms along with a reduction in morbidity of the illness. According to Call, who essayed Helping African American Children Self-Manage Asthma, the Importance of Self-Efficacy, children's perception about their personal competence positively influenced their behaviors, actions, motivation, and perseverance in self-management behaviors in the face of challenge. Moreover, a strong support system will encourage the child to reinforce their self-efficacy beliefs. Hence, it is highly beneficial for parents, healthcare providers, counselors, school educators, and all to support the child's efforts to manage their illness and to enhance their personal success to self-management. With support to the self-efficacy model, Hall highlighted three main points to be implemented in asthma educational programs: opportunities for successful self-management trials, opportunities to have self-management modeled, and constructive feedback on self-management behaviors. In another article titled Asthma Management Self-Efficacy in Parents of Primary School-Aged Children by Brown et al., it is mentioned that self-efficacy can be achieved through positive influences from the child's immediate support system, and in this case, it would be the parents. Willingness to learn with the child with regards to asthma management can induce high self-efficacy beliefs in the child. Self-efficacy can be negatively influenced if parents have poor coping skills, such as parental depressive symptoms due to their child having an illness, or difficulties understanding the treatment, hence diminishing the child's abilities to self-manage the illness. Therefore, the self-efficacy model can be applied to the case study, as there is a great sense of willingness coming from the child and her parents to learn the skills necessary for self-management of her illness. Therefore, educational interventions regarding asthma management will be successful when the main concepts of self-efficacy are applied, as it has been successful in the articles previously mentioned. Looking at the critiques of the self-efficacy model, we focus on the theoretical difficulties in the way that Bandura conceptualized efficacy expectations and outcome expectations, which make up the central concept of the self-efficacy theory. Looking closely at two distinct critiques, it is proposed that there is a contradiction and ambiguity related to these central concepts. Firstly, Williams pointed out that there is a contradiction in Bandura, arguing that there is no causal relationships between self-efficacy and expected outcomes. Then, once evidence came out to the contrary, stating that self-efficacy judgment remains valid when causally influenced by expected outcomes. Williams further went on to say that expected outcomes of behavior can influence self-efficacy. This effect is stronger for behaviors that involve regulation of behavior, like quitting smoking, rather than specialized physical skills, like using an asthma pump. On the other hand, in a critique put forward by Eastman and Marzillier, it is argued that although Bandura sought to make a distinction between efficacy expectations and outcome expectations, the definition remained ambiguous because efficacy expectations were defined in such a way that it included within them expectations of outcome, and thus could not be regarded as conceptually distinct. The definition provided by Bandura, outcome expectancy, is defined as a person's estimate that a given behavior will lead to certain outcomes. In contrast, he defines that an efficacy expectation is the conviction that one can successfully execute the behavior required to produce the outcomes. The critique by Eastman and Marzillier states that by including the word successfully and required to produce the outcomes in his definition of efficacy expectations, Bandura combines belief about ability to make a response with expectations concerning the outcome of the response. Overall, though the self-efficacy model has been shown to have positive effects in learning due to impressive empirical data relating self-efficacy to positive health outcomes, this critique poses the questions of whether the theory is theoretically sound. In conclusion, self-efficacy has frequently been related to the learning process and application of the behavior in the management of an illness. Thus, this theory is a good fit for our case study, as it has shown to be successful in previously studied cases on self-management behaviors, such as Call's study. Furthermore, in Stepney's article, the self-efficacy model was cited in illustrating how the school nurse plays an important role in promoting parents' self-efficacy to manage their child's disease by offering support and teaching them skills to manage it. For this reason, we strongly believe that the self-efficacy model is applicable to our case study. Thank you very much for listening.